Your baby was feeding well, until they weren't. Now it feels like every feeding ends in a huge mess, milk shooting out like a fountain, your baby crying, and you wondering what's going on. They're hungry again right after throwing up, but still losing weight. It's confusing and a little scary. What if I told you there's a reason behind it? A condition that's more common than you think and very treatable. Let's talk about pyloric stenosis. It affects about 3 in every 1,000 babies. That may not sound like much, but in the world of newborns, it's something every parent should know about. So what is it really? Pyloric stenosis happens when a small muscle at the end of the stomach, the pylorus, gets too thick and tight. This muscle controls how food leaves the stomach and enters the small intestine. But in pyloric stenosis, that muscle becomes so overgrown, food can't pass through properly. So it just builds up and builds up until the only way out is back up. That's where the projectile vomiting comes in. It's not just regular baby spit up. This is powerful, sudden, and happens after most feedings. Imagine shaking a soda bottle, sealing the cap tight, and then shaking it more. Eventually it bursts. That's what's happening inside your baby's tummy. Now let's make it simple. Your baby eats. The milk goes into the stomach. Normally, it passes through the pylorus into the intestines for digestion. But in pyloric stenosis, that passage is almost closed shut. The muscle is too tight, and the food gets stuck. The stomach muscles keep trying to push it through, but nothing's getting past. So your baby throws up, forcefully, and because their tummy is now empty, they feel hungry again. So they eat again, and the cycle repeats. Who gets pyloric stenosis? It usually shows up between 2 to 8 weeks of age. It's more common in boys than girls, especially firstborn sons. It can also run in families. But here's the thing, you didn't cause this. It's not from your baby's formula or something you ate while pregnant. It's just how the muscle develops in some babies. So, how can you tell if your baby might have it? The big red flag? Forceful, projectile vomiting after feeds. Not every once in a while, but regularly. Other signs? Your baby always seems hungry, but isn't gaining weight. Fewer wet diapers, or signs of dehydration like dry lips or no tears when crying. Sometimes your pediatrician may feel a small, firm lump in your baby's upper belly, about the size of an olive. If pyloric stenosis is suspected, your doctor will likely order an ultrasound. It's painless, quick, and gives a clear picture of what's going on inside that tiny belly. They might also check your baby's blood to see if all the salt and fluid levels are okay, since vomiting can throw those off. Now the good news, this condition is fixable. The treatment is a simple surgery called pyloromyotomy. Don't worry, it's not as scary as it sounds. During the surgery, the doctor makes a small cut in the thickened pyloric muscle. That's it. They don't remove anything, they just loosen the tight muscles so food can pass through again. Today, most surgeries are done through tiny incisions using a camera. That means less pain, smaller scars, and quicker recovery. After surgery, your baby might still vomit once or twice, totally normal. But within a day or two, they're feeding better, keeping milk down, and starting to gain weight again. Most babies go home within 24 to 48 hours. And here's something reassuring. Once it's fixed, pyloric stenosis almost never comes back. Watching your baby go through this is hard. You're tired. You're worried. You're trying everything and still wondering what's wrong. But now you know. There's a reason behind the vomiting, and there's a solution. If you see these signs in your baby, don't wait. Talk to your pediatrician. The sooner it's diagnosed, the faster your baby gets the help they need. You've got this. And if this video helped you feel more confident about your baby's health, give it a like and subscribe for more clear, parent-friendly medical info. Drop your questions in the comments. We're here to help. And remember, you're doing an amazing job, even on the messy days.